term them like this, where politics they shape with future, career they define with path them, and the economy they touch everybody in life.
Big thank you to Mr.
One program where they ask the hard question them and so bring the answer them close to you, face to face with the movers and shakers, the voice them will matter, the issue them will count. One time per week, one big name, one big issue, one-on-one on Liberty Online TV. Every Friday, 8 to 9 p.m. with Khadija Bangura. One-on-one, only on Liberty Online TV.
Council Salon also every decision they touch the life of plenty people. One program they bring the voice of the people to the heart of politics.
This na Politics and the People, the program where they give the power to the people, explain the truth, and bring the leader them close to the citizen them.
Real discussion, real voice them, real impact. Join the debate and make them hear your voice.
Every Tuesday, 8 p.m. Now you platform where they turn up for the true and civil engagement. Only on Liberty Online TV.
Let me talk about politics. Let me talk about people.
Hey! Enjoy the new collapse bundle price drop. Now you can get your weekly collapse bundle for 60 leons only on Maxit app. Download the Maxit app now on Play Store or App Store. Install the app and enter your orange number and password. Now follow them simple step here. Open the Maxit app. Next, tap the account. Then select airtime and bundle. Enter the number where you want buy for. Now, choose the collapse bundle where you need and the one where go suit you. Finally, type your password. Bam! All things set. Subscribe to the collapse bundle today and enjoy more browsing for small couple.
Orange.
You are watching Liberty Online TV.
I think currently I have a thing for Vicky Remo.
Hello viewers, we don't bring different content into you, and we know the tire for make the content there where you like. And now we dey bring fun and shorts with Adri. This na game show also your favorite celebrity, social media influencers, students, and other people play game they like, truth and shorts, charades, riddles, and other game there where you self go learn from. This content will come to you every Sunday, 9 o'clock na net. Now all the Liberty Online TV social media platforms there.
She chose number one. She's always number one.
Period.
On top.
Period. On top.
Yeah, man.
So not miss out. Join me for laugh with your favorite celebrity and social media influencers there.
Hi, I'm Leo. Want to know more about me? Chat with me on Instagram, Facebook, WhatsApp, Apple Messages, and Google Business Chat. Search for UBA Chat Banking and always look out for the verified tick.
This is Liberty Online TV powered by Orange Sierra Leone. Orange.
Good morning, viewers, and welcome to the Breakfast Show, where they come to you live from Liberty Online TV, where they stream na Facebook, YouTube, and also na we website, where they powered by Orange Sierra Leone. We will they bring this edition of the Breakfast Show come to you this Friday morning. My name na Khadija Bangura.
And Mina Mebel Kaba, good morning. Today na Friday, the 24th day of October 2025. Inside this edition of the Breakfast Show this Friday morning, if you've been following the conversation yesterday, we'll be talk about the issue again we get to do with Kush. And we'll continue the conversation this morning, but now this edition of the Breakfast Show, where they can talk to the consultant psychiatrist, now the Kissy Mental Home, where they can tell you exactly how the picture sound like in terms of treatment and recovery of victims of Kush. Now, that's not the conversation where we get now this edition of the Breakfast Show.
All right, as you all know, Salon, they battle with a crisis we get for do with drugs and other substances them we don't make plenty young people then life then right now they go through serious challenge as we don't they see concern of the body them where they don't have state so then they allege say then die from Kush. And we continue for look at the efforts where government they make for ensure say then put things there in place where go make them control the way how this particular substance we allegedly then say na inki make the young people there so we can die in a state and young people here we can get so foot them plenty pan them, and according to numbers they would on the area now that it don't they go up. So today we can talk to a medical doctor and somebody we don't they before, especially where it camp mental health and non-communicable disease them, somebody where they in charge of the Kissy Mental Home. As we all know, now one of the places then now where government don't turn to treatment center, outside people them where can don't get affected or don't become addicted to this particular substance and they can then go for let them get treatment. How they reach to the decision for let them turn the Kissy Mental Home to a treatment center. All of that you go know inside this edition of the Breakfast Show. If you say get question, you get comments, send them through the comment section on the number. Send them through the comment section at any of the platform them where they watch with this morning. Remember, say we stream live now we website and at Orange Sierra Leone the power we website. We also then at YouTube. Now for going to YouTube, if you're not join with YouTube channel, it's kindly subscribe to our channel. And also on Facebook. And this morning a pleasure for introduce with studio guests winner Dr. Abdul Jalloh. Good morning, Dr. Jalloh.
Good morning, and thank you for having me here.
All right, so we know say this is mental health month, but in as much as we can talk about mental health, but let we talk about the current crisis where the country they battle with now, when drugs, especially a particular substance where the layman no say then can call and Kush. I don't know if any other word they for through on your medical terms. Then firstly, from a medical perspective, we then say Kush. Waiting at this substance we make up of Kush.
Yeah, Kush na a psychoactive substance. When we say psychoactive substance, na drug or anything really affects the way they think, they behave, and in terms of decision making. So Kush na one of them, and Kush na is synthetic type of cannabinol. But the Kush we know before, when at the K2, it's quite different from the Kush we get now. So now, the Kush now we get now, na mixture of different chemicals, different substances there. It's like a concoction. Take this, put in that, take this, everything. Don't they call a Kush? And this Kush it's toxic. It destroy motor man from your head up to your foot. It affects your heart, your kidney, your liver, everything that in your system, because it gets what we call toxins there, poison there, where they destroy motor man in whole system. So now this Kush not again a salon, but the guys the way they use this Kush. Then get different types. They get the one where they say Jagaban type. They get the one when I the tramadol. Then even you know say they get the one where they mix with dye. That gara dye. Yes. So they get different types. And again, when we analyze or we do the drug toxicology, we find out different types of substances that they use. So it's not only the Kush, or it could be say the Kush that they mix up with the other substances like cocaine, diazepam, ecstasy, cannabis, different things there. So again, Udepa does one study with one master student where we try for analyze. We use the blood sample and all that in there. We find out say we get this other type of synthetic drug where we call K3. K3 na other subsets of cannabinol. But this one now, when we go further for analyzer, it shows it get even the spray there, shell tox, glue where would they use nail remover there. So this only they show say the Kush not just one thing that they use. They use different chemicals there. And now the Kush they see not to imported one. Now locally produced Kush now, because also they use all that they just for make they get the same effect, the same pleasure where they get. So the Kush business is just like it's like a general name. Yes. For just like I do, you go name a particular thing, but not different thing. Before early 2018, 2017, the Kush by then now they be mixed up with jamba and this leaf first, the snake I call herself kukumbejara. Now in there they mix with, but now they don't move away from that one now. Yeah.
One other concern we don't come up now the issue of the sodium, now the foods we just make mention of, say now because of the different substance them more than they mix now they affect them from the aid to them foods. Is it possible that as soon as you become addicted to this particular substance, some of the effects them are then so there?
Yes. It could be so many things they come into play. One, the substance there, they cause what we call vasoconstriction. That they narrow the blood vessels there. They make the blood circulation they reduce, and when blood not flow in a particular area, it cause what to call gangrene like. So now they make the source of their happen. That now one. Secondly, we got against what to call vasculitis. Vasculitis is like inflammation of the blood vessels there. This way, but again, they restrict the blood flow to different parts of to a different part of the body. Also, they cause blood not for go in a particular area, and they cause that place they for make it I would say for make it die. They get what to call necrosis. Then the other one again is maybe the person gets an underlying medical condition, for example, diabetes, okay, or HIV. The person no know. Then now that they show say the person immune system don't become weakened. Then you go take that substance there, then back the can for car add to the for weaken the person immune system. So if you get small infection self, it gets so forth, and that's so forth it go difficult for make a heal. Yeah.
When then they take the drugs, you don't explain how it affects the one way they take the drugs. But how long the drugs stay in them for let it begin manifest that kind of way they?
One again, it depends on the type of the drugs, and also the duration of the usage of the drugs there. The longer you continue for use them, now the more you prone forget the kind of thing there.
So the one that waiting at the hospital, give we how the picture sound like. How first off them begin going at the hospital, because the Kissy mental home, you ask many people and go tell you now people who them believe say mentally disturbed can they. How we begin talk about people who they deal with Kush now the mental home.
Yeah, one thing about substance abuse and mental health, now like twin day. Now they worker. Now that make most times we get what we call dual diagnosis, comorbidity. Sometimes the person they use this substance, and the substance they make it get mental health condition like depression, psychosis, we possibly the different things there, or see different things there, or begin they get some kind disorganized behavior in a society call for. So that substance they go affect certain areas now the brain. We're responsible for the way they think, the way they feel, the way they behave, and even in terms of decision making. So whether that affects their areas, then it go begin make them individual start for get their abnormal behavior there, the way we call mental health condition. Again, somebody will get mental health condition, it can use that substance there as a way, say yes, what take this substance, it will make her forget about how they feel. For example, if person depressed, it go say make her go take alcohol or make her go smoke. If you ask most of the guys there why they take the substance there, they go tell you say, not because of stress. Are overwhelmed. So I do use that thing there for make a calm myself down. Without them knowing, say, that substance there, it worsen the mental health condition we they get. So at the hospital, now teaching hospital, where they provide evidence-based care to anybody who gets substance use issues or mental health condition. So from where they establish the hospital over 100 years ago, the hospital be done there for treat people that will get mental health conditions, including substance use. So not now we start for admit patient there. The only thing is the Kush.
It's about the substance, this particular way the country they deal with right now.
Kush,
how it come inside.
The Kush, we start for get a Kush patient in an hospital since we have taken over 2017. Now we start for collect data. But by then, we don't do any drug toxicology. Now wait till the patient they tell we ask us say wait to take you go tell you say na Kush, na tramadol, na jamba. So now that record we get. But after we refurbish the hospital, we get lab. We start for do now test for know exactly. And that guy they tell we say na Kush, and when we do the test we find out say na different substances there. So I go say from 2017 to date, we don't admit patient there with Kush and other substances there.
From 2017 to date, as you state, so not only admit patients them we na victim of Kush and other substance them. But a lot of people will not get access to on statistics or data, go get the perception say this particular moment, especially for the past 2 years, the Kush don't the intake they on the increase. Based on the data we wanna get na the hospital, how you can assess from 2017 to now in terms of how una they get the patients them at the hospitals?
Absolutely, it will increase. Of course, it will increase over over 100% increment. A high. That definitely, because from 2018 to date, the cases did increase. But last year, where the president be announced that public health emergency on Kush, the case did be decreased small. We will be see a reduction in the cases, but after 6 months, they will begin to see back a spike of the cases there. So, like from this year alone, from January to September, we don't see like 2,795 patients there. Substance use, yes. So substance use. The Kush, of course, nine in the highest, and again, we don't also do national survey. We don't show say Kush nine they on the higher side, but because we do a national survey where we interview over 16,000 people in five districts there, where shows a Kush a high pass all by the substance people use.
This data we you just don't tell the viewers then this morning. In medical terms, normally una can get stages them una they each for declare a particular crisis. Say maybe it could be an epidemic, it could be a pandemic, una can get the different stages them. With the figures we you just release so now, and I believe say when I get a daily stats where they come in for inform una if they go up or if the measures the way governments they put they work, or maybe una need for change strategies on now una for FETAM. What stage you go say the Kush crisis they now in the country?
Of course, we don't say na a big concern, and I think say that make the government last year they declare as an emergency because of the spike in cases there. So it's serious, but again, this substance use issue, not to we normal. If you not the sub region, but because be the part of the network of people where they talk on drugs, where we can get a meeting there every 6 months na ECOWAS. They should say the issue of the drugs is na a global concern. Even for the US or the UK, this issue of drugs na a global issue where I think say we all na society for come as one for make we able for tackle them, because it's serious. Imagine promising picking the school going, picking the university, final year students they drop out of school because of Kush or substance. Where it shows it affects the individual, it affects the family, and it affects the community, and even we the service providers there.
That brings me to the question for categorize, because you say from January to September 2025, when I don't get over 2,000, right?
Yeah.
We don't come into contact with substance abuse. Categorize them for we by, let me say, age brackets, sex. What are them a common among this drugs abuse?
Yeah, the age now between 18 to 35 years. The youth, we should say, if we not come together as a nation, the future for this country, it could be challenging for me to be able to achieve what we want see for the country. Because imagine a whole generation between 18 to 35 years involved into substance use. Of course, na Monday more. But the issue with substance, the effects in female a more higher, a more serious than man. If woman take a substance, it affect them. It affect even for give birth. Although also man again, it decrease the what you call libido. But woman now, imagine now saying this woman, get belly, go take Kush or substance. It affect them and the picking. So the Kush business, it affect everybody, but the youth and man and get back we say secondary school more and the unemployed. Or unemployed, when I say unemployed, now the one day we not to office, but according to the study we recently do, we see the back riders there, they take a more. The bike riders. Now that make one of we interventions there, or we approach now for engage the motor drivers union, the bike riders, the keke, for see how we go raise the awareness to the for sensitize in terms of this Kush or adulting.
Dr. Jalloh, when you look at videos them we don't they go viral, two things. It shows the Kush what they discussed this morning and other substance them don't make them way into the schools. You dey see a video of young small picking there in the fet for Kush. What's at the youngest age where you don't come in contact with them bring at the center?
10 years. 10 years. Yeah.
Wow. What's in the testimony of that 10 years there?
It's na get again.
From outside? Is it from the home, from learning institution,
No,
from outside?
No, in house surrounded. Not a school. Not in home surrounded.
In them cases, then the doctor waiting at the treatment where ona can get to the young age. Then they, for example, the youngest age we don't come in contact with not 10 years. In a young case, it can different how they handle them like the big one them a bit.
Yeah, it's different in terms of the medication we get the assessment is different because that not a child. Yeah, and we get the child mental health. So it's different. Yeah.
There's this perception that the drug abuse don't reach to a point that even una self na the hospitals where then they go the space no they you need for putting where one person discharge space there, then they bring you in. How to is that?
Yes, we can overwhelm. And again, we to for no is the hospital the only psych hospital will get the whole country for a population of 8.something million people. So just imagine, and the best we get it's like 220 of 50 beds hospital, we receive patients there all over Sierra Leone and even from Liberia, Guinea. They say they come now the facility.
For one treatment center they do now. As of now, as we speak,
Kush?
Yes.
Not currently active, functional. Currently.
We mean that just one day for now.
Yes, we're functional, But we get na Hastings, we get na Gudama na Bu, then for open one na Daru and Bombali.
How the treatments they sound like? Is it by stage? Explain to the public for understand.
Yes, now by stage. Yeah. First of all, we proceed into addiction. Most of them can start through experimental peer pressure. Say, this thing is not nice. You back. Sister make you see. It start them. When it start that thing, we get what we call dopamine. Now we brain there. This now a chemical way responsible for regulate we moods there. Right? You get a surge of this dopamine now the brain, and this surge they make you begin to feel some kind of way where they say, wow, I'm top of the world. So now you continue now for use this drug for make that feeling not go away. You become dependent now on the drug now for make you continue for experience that feeling there where they get.
So just one taste.
They
They
make
tempt you for continuing.
Yes.
Because I've been listening
Yes.
a testimony of a parent this morning. We say in Pekin, they take these same drugs. He carry and go for treatments. The men may come. He come. He heal up. He come. He go back. But 3 times. So the parents, according to them, in decides to let himself know waiting make this Pekin continuously. They take this. That moment he take that one himself and himself in the hospital because continuously he keep hanging from.
Yeah. That's a fact. Yeah, just one. If it's a small one, safe, you take them. You become addicted to them. So because addiction, like chronic relapsing brain disorder. Okay. So again from that 2007 and 95, what I say, we don't discharge over or must say we and we get over 2,500 where we don't discharge, where we don't able for manage, stabilize, return back to society, where they don't follow up. However, with the issue of substance use, the person now gets the decision, the willpower, the determination. Now for say yes, this I'm not going back.
How long did it fully take for you fully recover and say this is safe for go back to the community?
Yeah, when we can detox you, approximately 10 to 10 days to 2 weeks, we detox you. Detox means we don't pull the drug now your system, right? Then now we can engage them now in terms of rehabilitation for make the series in not for go into the drug again, because we enroll as mental health professionals there for an addict. We just support them and guide them through the process of recovery, because addiction is difficult. It's very, very difficult for a person just left something. So majority of them can go and come back. So some can go, some can get relapse more than 5 times before ever they win off the drug.
We'll talk about that one way they take. They put you to a certain way will make you want more. For example, if somebody take one sting of Kush or any other substance, how long did it take in system before it urge for another?
It depends on the type of drugs we the person take. Some like cocaine or other one, there's 2 to 3 days. Jamba. It depends on the type per se. Some after 8 hours, if you not take her, you mix up with the torment. So pass you go take her. Some after 2 days. Some after 5 days, some 7 days. So it depends on the type of drug where the person they use. But like for Kush, very, very short, maybe 6 hours, 4 hours. if you not take up, like say like say they can die. So you get some where they take 8 wraps per day, 5 wraps of Kush per day. So it depends on the type of drug. Yeah.
One thing where plenty people believe say they get challenge pan the fights. Now the one way them believe say they mix the chemical, then where them people can get access to forget them making difficult based on the testimonies them, because I guess when I can get conversation with the one the way when they get their patients them based on the testimonies them, how most of them can come in contact with the drugs.
Yeah, most peer influence. Peer influence. Most of them say na me party put me.
Buy them, how then they get them? Who side then they get them from?
Also, the Kush or drug. They also they. Na the workplaces, na the universities, na the communities, everywhere currently. The Kush or the substance, the drug business, they also. So now in fact, no, it's bread for defend anybody for say this person not go involved into selling Kush or substance no.
So the one way they take it's possible for let people and they take them substance here. You see them, not appear like them they take them, but some people they wouldn't take them, they knock them down easily. Like we can say we get posh Christmas them. It's possible let them somebody they take them, you not see them, you not notice them at all.
Yeah, just like I say, it depends on the person in the genetic makeup, immune system. That one, and again back, it depends on the quantity and the frequency where that person they take.
So Dr. Jalloh, now which quantity or which frequency the person go don't take where they make now they become destabilized, you jump in the street, you begin get sauce there, you begin pick food from dirty box, because I'm pretty sure so you don't come across them videos then they where they viral. Now who stage down they, because most of them now, just like what you say, substance abuse now and mental health not twin them. Where you go see them now you go feel na possibly mentally disturbed. Now what's frequency then the way you go don't take or go put you to that situation.
Yeah, not to say if they feel say you don't mentally disturbed. He's mentally disturbed because we get what to call drug-induced psychosis. He got the mental illness because of the drug. Now we say drug-induced psychosis. The drug don't make the mental illness don't come out. You don't know something. Maybe that person maybe get an underlying mental health condition. You don't know. Then you go take the drug. Now that make the factors the way they make person get mental health condition. Substance use now one of them. Second, your genetic makeup, family history, stress, now work, now relationship, so many things there can trigger a mental health issue. So it depends on the individual. If you get an underlying mental health condition, then you get stress or anything, or maybe get a mental health condition like family, then you go take substance. Now, like you don't put petrol na fire. You just make the thing, the mental health condition just pronounce, just become visible now. So the frequency again or the type for make person gets that kind of behavior, it depends on the individual. You genetic makeup, if you not get any mental health and underlying mental health condition, or if you not get any other thing where they play around you as an individual. Yeah. So in fact some like you just take half. You see the beginning misbehave or begin behave abnormally.
Is it possible for the Kush kill person?
It's possible. It's possible. Not only Kush, but drug, anyone, even alcohol they kill. Even cigarettes they kill. Yes, it's possible.
I go identify a body. Will they ask all of them question there because you are the medical person, you know the expert now. I go identify body, especially in a street. You know, say this na Kush kill am, even with a possible. Let's just see the body in a street. You say this na Kush kill am, even without doing a postmortem.
No, me not a magician. For make I just go see the man on the street as I say na Kush killer. Until we do this scientific evidence, do postmortem for determine that one day. Although we get complications of Kush use or overdose, we can make person die. But if that person we don't die, not tell you say, now this will take, now I make her die. Or me not a magician for make her able go see die man assassin a Kush. Or for example, you see royal also now. I'm not gonna know waiting you don't go now in your life. Until I can ask you, you tell me. Right?
Yes, yourself the free tongue, yeah, and you don't see young people around the streets. How you go describe then young people where you can see where plenty people they categorize say na Kush then they take. You go even see some dead body. People go say, oh, this na Kush be they take, so you don't get pendant and say don't die. How you go describe then kind people in there?
Yeah, it's cool. This is so the infection, the sepsis. Not kill the person. It could be say na malnutrition. It just like way COVID be there. Not to the COVID per se, they kill the person. Now the complications of the COVID or the mpox, the complications there. So the same thing about substance use. You get complications there. One, you get what we call the overdose. If the person go take excessive Kush, and the Kush now will get different chemicals. You go take excessive one, you get overdose, you go die. But pass the pathologist go do a postmortem or they do some forensic analysis there where they show say yes, this now this chemical what this person take now make her get this thing. Just like way person die in hospital. We know they say na hypertension na kill a person. So we say na cardiorespiratory arrest secondary to hypertension, secondary to this, secondary to that. And pass back again the pathologist go do the test or go do postmortem for no say na this na heart attack na kill this person na in this. We wait to make way person the way that you don't sort of fet the person die. They can say make the go for go do postmortem for determine if indeed now the bit where the beat a person they now make that person they die. It's the same thing for any death. For any death, me to talk on as a medical professional. For any death, the cause of death has to be proven by the pathologist. Yeah, Alex, if you know say this person na heart attack, na killer. But unless the pathologist go confirm say yes, indeed na this na kill person, or now where they strangulate the person, now make the person die.
Like we said today, we talk about treatments and recovery. And you then at the hospital where it's available for them set of people here they go. You've been say earlier from January to September, now over 2,000 when I don't get the where you don't come in contact with drugs. Let we look at this over 2,000. How the recovery rate stand like to that of the one them where perhaps unfortunately not be make them they lost their life.
Yeah. In fact, I would say For the past 2 years, now the hospital, now just one death we don't get. And that's safe na medical condition. We don't discharge over, but people who don't stable. Just like I say, the for follow-up case they will get. We they come out of hospital for medical take their medication, for counseling. It's over 2,500 people there where they come. And from 2018 to now, we got over 15,000 people there. We don't treat now at the hospital where they come for follow-up. So for the hospital, imagine for over 2 years now, just one death. And that says that the person in age and back he gets underlying medical condition. But we not get anybody in the hospital who don't die of Kush.
But from waiting you see the picture where we see in the different states, and especially in a free song, but they happen back in other parts of the country.
Yeah.
How you will compare the rates of the one where they get access to the government treatment, that is psychiatric hospital, so that's of the one where they in states?
Yeah, one thing me always they say the hospital not the face of the country in terms of mental health. Just like we get airports, Lungi Airport. If Lungi Airport get problem, it means say we whole aviation system get issue. It's the same thing with the hospital. If the psychiatric hospital 191 we get challenges, get issues. It should say yes. Mental health na a big problem in the country. If the cases in the hospital increase, the high, it should say beaucoup in the community we undiagnosed. We need help. We need for come for care. So if we get massive over 2,700 patients at the hospital, it means we get tens of thousands of people already outside. We get issues with regards to mental health and substance use.
Dr. Jalloh, let me talk small about recovery. From January to now, we una begin experience increase again on the cases. How the recovery rates don't sound like? Not like the one the way una they pull out of the treatment center, then get in contact back with the substance and come back. The one the way una go check and no say yes, this one is mentally stable, he or she is fit for go back na the community.
Yeah, before ever we did discharge the patient na the facility, we don't certify say yes, this patient fit for go back in our society. Means because recovery na a journey. Not to just one time something. It's a journey where involve with the service providers there, the community, the individual, the family, for make that person to get a total recovery, right? So we enroll now for stabilize the patient. We see say yes, we certify say yes, this patient don't fit for go back to in work, to in waiting they do before ever we discharge that patient.
Which means when they play two roles, when they treat and also serve as a rehabilitation center.
Yeah. In fact, we get a rehab center at the hospital.
Okay.
Yes, we get a whole because na teaching hospital, and that's one of the requirements there for make the certify we as a teaching hospital for make we train psychiatrists then na the hospital. We forget a rehab center. It is a very standard. We get the addiction people there. We get the mental health nurses there. We get the psychiatrists there. We get the psychologists. We government contract. It did it for help we. So now a whole we render a holistic care to that patient.
So the recovery rate, the one them way una they look after, ensure say they are fit for go back into the normal activities, just like what you say, a high past the one they wouldn't they bring in.
Repeating the question again.
And they try for ask the recovery. Is the recovery rate to the speak now, the way people when they recover from the center and go back to society, a high past the way how people when they come in contact with the substance?
Well, for the one way they come out of the hospital, meaning they talk about the whole of the country because now angry hospital will get with the but even data from the provinces from the mental health nurses also the shows the drug business a high, but before the hospital will get more inpatient than outpatient, but now the inpatient and out hospital they're very few, like 150 patient in our hospital.
What's in the inpatient and outpatient?
Inpatient, na the one who they admit. We then at the facility. We stay with outpatient. Na the one who they come for follow up. Just like I say, we got over 2,500 follow up.
How can determine say this in need for be inpatient?
Well, not through we assessment. So they assess you. Then now that the influence with the decision.
Dr. Jalloh, who's one of the worst case we don't come in contact with?
For me, addiction not the most difficult thing for treat. Because one because you don't try for stabilize the person. You don't assure you all, give you all your assurances. Say, doc, where I go? I'm not going to this thing again, forever again. Thank you, Dr. Jalloh. Thank you, this doctor. Thank you, this nurse. When I thank you. Hey, me, when I thank you. But as that possible, so 2 days, they come back.
That brings me to the question where plenty people go to ask now, because whenever I host government officially for talk about the issue of drugs, then go justify say governments don't do them best. But you go find out say the number they increase seem like on a daily basis. You go hear it cry say people they die from on a daily basis. From your perspective, outside the problem day where instead of it calm down, the number they go up of the one the way they get access to the drugs.
With the drug issue, there are two ways: the supply and the demand. Right. So we enroll as a Ministry of Health now the demand side for reduce the demand. Now we enroll now demand reduction. The supply reduction now then I get the law enforcement agencies, police, the NDLA. Me not going to talk for the supply side, but for the demand side, of course, we get challenges.
What's not the challenge? Because the demand is high. Because now the demand high make the supply the day.
Yeah, so we now for make we able to reduce the demand for the person, take the manpower. We very few. The mental health professionals there. We very few. Even also the medication there. Because we get different medication there. We they give the people whether they need to withdraw or overdose. Their medication they not easy forget in country, and also even the one way the medication they're very expensive. Not your normal, even international. Mental health now the most expensive thing for make we able manage. Expensive all over the world. Just a few weeks ago, because now is that we try for include mental health into the health insurance scheme where the government they try for implement. So when we don't do the draft estimate for mental health alone, for this side insurance, you don't overtake all other health issues there. We should say mental health is expensive. So the cost the availability of the medications there, the infrastructure wise. Imagine we just get one psych hospital, but again, what again we dey try for doing? We dey try instead of now is that we dey try for move from hospital-based care to community-based care through the primary health care. So now we dey try for integrate mental health or substance use into the primary health care, and also so that people are able to get access, easy access for their service there. Again, we dey try for integrate mental health and substance use into the disease specific programs there, like HIV, malaria, child health, maternal health, because we see say mental health and substance use it affects an individual at every stage of in lifespan, starting even for make the person get belle, you get the pregnancy, we born, after we born, the pikin, adolescent, young adult, up to where the person they become a senior citizen. So they go be get now the dementia, they begin for isolate them, you get depression, all that thing. So now that we try for do so that the so that we were able to try for bridge the treatment gap, because currently the treatment gap for mental health na Sierra Leone is very, very high, about 98 to 99%. We mean say about 1% or 2% people that they get access to care for mental health. So for reduce that gap there, now that's what they do. There's secondly again for first to get back the stigma, because most people when they get, I don't see family members there whenever you want for make the picking or the relatives they go to the psych hospital. They say no, doc, that place there, the stigma. So now we will try for tackle stigma. Now that make we don't establish what to call the mental health champions network. We involve different people there. Journalists that they inside, even Lamran Aban, now one of the champions there, Umar Fofona, Fabian, Asma James. Oh, but cool. We get youth there, we get politicians there all where we incorporate for be as mental health champions, so that we're able to fight this stigma, because stigma is a major barrier to care.
When we look at the current issues there now, government don't declare, President don't declare a state of emergency, they don't set up a task force who I believe say not all they work together, but yet still the supply chain are the problem. And as it is now, people they get access to them, then they buy them. What you feel say will be one of the robust measures them for put in place now as the country they battle with this crisis?
Yeah. The one thing I want to say is this one now we all get for come together as a nation for make we able to tackle this drug. We all day live in a community. We sabi we safe, right? So if you see possibly they sell this drug, or you know say this person the lifestyle way they live, not also a blank live back you know see this person a walk or so something where we say a commensurable to the kind of lifestyle way they live. We need a lifestyle audit, and that could be only achieved if we the community, we the people now Sierra Leone, we try for put aside we petty thing there, work as a nation for help the government for make we able tackle this issue. Now, just like I say, no, it's built for nobody. For say, this person not mixed by drugs business. This person, this person nah, I'm a doctor. No go mix. Everybody is a suspect.
Because of the kind of work you and your company they do, they make her feel like una get a lot for do for breaking this supply chain, because una they come in direct contact with the people them we don't take the substance. Una they get them testimonies them. It's not possible let any of them take una to the community outside and they and show outside and buy the drugs.
Yeah. You don't like me.
No, it's just question where they kind of in mind, like, I mean.
They can tell me. Yeah,
but patient confidentiality.
Yeah, exactly. Then they get back. A drug addict don't ever tell you the primary source. Like say they take out. Instead, it will just tell you how am I the getter, I the getter, how you the user, but for say you go pointing at this person. Like say that go to the call down they call a plug, not plug they call it plug. Then not ever show you that plug. But now so say police now whether get ways and means for interrogate them. But for we all roll now for just it now for make it tell we how it feel. If it take them, how it feel, we not take them, then we guide them through the process.
What think you make, because as you start earlier now from 2017 to now, the issues there don't start. And even we say na the media, not till now we begin to talk about some of the issues there. What think you make something like this, everybody they talk about Kush. The rate at which the figures them they go up, then all of a sudden they begin countdown back. Like now something was seasonal.
What about drugs? Drug nothing we am at for fetal.
Why?
You know now.
I don't know.
With the drug business, you don't say they get a cartel and they get all and they get all the resources there. So I think very difficult for faith. Very, very difficult. The country where able fetam na Africa work you use as best practice. Now Mauritius. Mauritius used to be like a hub of opioid heroin, but now they're able for reduce them. The drug issue.
Right.
Because all my come on board. Everybody, the government, everybody, the community, family members, everybody come together.
If they see something, they for say something.
Yes.
So if you are to say something to the police right now, whose community in Freetown, for example, where you want to let them shine their eye, based on the testimonies and where you hearing?
Also, drug business, they also.
So the entire country in a hot spot?
Drug business also mean because we say hotspot, it means it's more prevalent and that. But for me, the drug business it's everywhere. Workplace. So who knows? Maybe when I get person as it. Now office as a self so they take out. We don't know. So it's everywhere, even at the hospital. The hospital we get. Interestingly, they even get family members there who they go visit their family at the hospital. Where we don't catch, where they traffic the drug for the patient in the hospital.
Wow.
Yes, it's everywhere.
So no sign of safe.
No, we say not safe. I mean, say we are in a very I go say
so the public they perceive
the level I call it because you know say security the get level of with safe. We say no sign not safe. It means say now very high.
Yeah.
It's a risk. Me go say everywhere is a risk. Yeah, it just left to you, the individual, for make you not take them, or you take them, or you go buy them, or you not buy them. But it's everywhere.
How you go determine, say, this person, they take substance? Aside una the doctor, they will maybe go do some test.
Yeah, you observe the person behavior. You know this person. For example, you a Mabel down the work out. You sabia for so many years now. You know how they can walk, how they talk, how they behave. Then suddenly now they begin to see Mabel go can begin to ask you for money to trust. So yeah, let me you know they see waiting they go do the money. Then back you see we can office, he could become restless. And you know go see the one side, quick in the one, he begin to appear now untidy. And but in body they reduce. And you know they take care of himself again. That's for shows red flag or point out to you say, oh, not to so Mabel Blunt's behavior. So something is wrong. That will come now. Your role for support them.
So we begin watch we say.
Of course, yes. We for the watch yourself. Yeah.
Anyway, well, if you just tune in today, they get a conversation with Dr. Abdul Jalloh, when I consultant psychiatrist from the Kisi Mental Health, and also in a director of communicable disease from the Ministry of Health. We don't talk about drugs and other substances that now we the country they battle with. Doc don't give you the statistics. We clearly show say from January to now they don't experience an increase. But although again the increase they're able for treat people them, and then they go back into the communities. You know, mean say if you don't come in contact with drugs at the end of your life, if you're willing, go na the Kisi Mental Health Center. You go meet Dr. Jalloh and in team, they're ready for help you. They not just they treat you, they help you for give you some psychosocial counseling, and you go back to the community. Doc, then people are can therefore go back to the community after several assessments. It's possible a person go and come back about several times?
Yes. Addiction, just like I say, now a vicious circle. We just like we possible use for drink coffee. So man, if not drink, in fact, this Nescafe or coffee, you know, see back in a drug.
Really?
Yes. Yeah. It become addicted to that. Yes. Yes.
So anything where you become addicted to, you go consider as a drug?
Not a drug different, but even lifestyle back, he become addicted to a particular way. So addiction is like if you not do this thing, you're not able relax or comfortable.
Yes, like that person where if you not drink Nescafe for the day, like it become very torment.
Yeah.
Until you drink and they feel like it don't start in day.
You see, well, that's
so like that now serious addiction.
Torment, yes. Restless, yeah. Yeah. In fact, that now the anxiety, maybe because with mental health, we get a spectrum. A spectrum, you get the mild or common mental health, then to the severe one there. Anxiety, anxiousness, worry, apprehensive, those are all signs of anxiety. And most times, where I be study. Do me residency in Kenya. For study, I'll be take Nescafe and it make I not sleep. But time become I begin me and I begin a tremors. I stop them. Then I begin drink lot of sugar, juice, 30. Then I begin notice rash then me and I do all kind of tests and I know you will know exactly what in and so one day now just make I just stop for take soft drink or let's say after 1 week the rash disappear. So addiction they occur in different way. I'm going to get we say drug addiction. You can addicted to so many things there. Although addiction with OCD, obsessive compulsive disorder, sometimes we can miss understand that. Because with OCD, for example, like other child this so that's always you want to for day. Yes. You don't want for come you can be see like me so I get that kind so, yes, I want everything. Yes, I want everything for be perfect. Everything what they do is for be perfect. For this so everything is for itself. So
based on the statistics we wanna get, the number of people where they out now, when we're able to get access to treatments, the issue of drugs, is it safe for saying an epidemic na salon currently?
It's a concern. Yeah, it's a concern. The people we get right or the legal authority for declare something epidemic now the National for Public Health Agency when are the legal authority. Me just treat patient and guide with data. Yeah.
But the data where you get, they speak towards that path.
I think now that make the president be declare last year as a public health emergency.
How often
for sure say na concern, na crisis.
How often I can release the data there so to government official for like draw their attention, say we need for intensify the measures them again.
Yeah, the data there. Of course, the hospital now a government facility, so we can give them.
Yesterday we talked to the director of communication for the presidency. One of the issues them way is about funding. Government is struggle for allocate resources to the fight against Kush. As it is now, na funding una need or na community collaboration, just like what you say, una need everybody on board for cut the chain.
Yeah, even I think we need I think we need everything. Without funds, you can't do anything. You can't even buy fuel for go meet the community or for invite the community. You need the fund. You need the resources, both human and infrastructure, medications. So we need everything. Yeah.
When you look at pictures and videos them where they go viral, just like what you say, no sign or safe, because even the law enforcement body them way for enforce some of the laws there for try for bring to book people or the manufacturer now, because I understand that there are labs here now where they manufacture or they mix all of them substance there until they get Kush. The police themselves they take her. You don't see pictures of them when they sleep by themselves. We think can cause this excessive sleeping. Now they see person when they sleep by themselves. What exactly they can put inside it?
Not the chemical where they take. Like tramadol or make I say opioid. Their own side effects. Not sleeping like you. You just sleep good one. Now that make them we give people that get severe pain. tramadol for calm them down, then for me they able to rest and sleep. So now imagine now, you don't go take 5 tablets of 225 milligram of tramadol. We be say the dosage what we prescribe maybe another 100 milligram. That's it depends on the severity of the pain Then you go take 5 or 7 tablets of that per day. You go sleep all day.
But Dr. Jalloh, a lot of people again they blame una the medical practitioner them. Say now una can make them people get access to them here. Me and you know say there are certain countries them na the world where they go for let you buy medicine. Then go ask for all kind documentation. In fact, so then go even ask you for bring you ID for show say you reach this particular age for take this particular drug. But Saloya, anybody can just walk a go na any pharmacy. In fact, even in states, then drugs they are dead.
Yeah, that's not a concern where I think say the pharmacy board they actively they work on because especially they control the drugs there. And just give you an example. I get patient in here. We need certain medications there. We know they in country. So if me self when a psychiatrist here, I write prescriptions. Say go buy this medicine na Ghana or na US or UK. Then not the honor because I not get a license for practice day. So past sometimes I call my colleagues there, say I get patients one need this medication for. They can write the prescription for me for make that patient they get that medication there. So, I think say we get the laws there, but now the implementations of the laws there are not the challenge. The laws that they way for able for address some of the issues there.
What do you feel now the most workable strategy as it is now for curb this?
I think we need everybody for come on board. Awareness raising, community engagement, for treat the guys there, then for go after the one way they. Now, in fact, now the drug local production now. Majority now local. According to waiting the guys that they tell me.
But the chemical they wouldn't mix with snack.
Yeah.
So if Salon not begin produce which means for Cobham go be very difficult.
Of course, difficult. Drug business, I don't tell you say, for prevent and controller. Difficult. And it need a lot of resources.
For now, I go able again for help the one who they can at the hospital access to medication now one. When it comes to access for letting get the right medication for help them. What you go say about that? The medicine in the hospitals?
Yeah, we get medicine in the hospital, but of course, due to the patient's load in the hospital, sometimes we can get challenged for get them on time. Yeah, because we get one NGO when they help with the medications there, and considering also this sort of supply chain challenges where they get for pull up from the US for Kautania, sometimes they get some delay. Yeah, and again not to all the medications there they self-able get for we because just like I was saying, with medications they're very, very expensive. They're very, very expensive. One grain type of medication, so until about 300,000 leons per month. 400,000. In fact, we get some injection there where they cost like $500 per dose. They're very, very expensive, very expensive.
So in this case, for the one that we're not able to get access for go now the psychiatric home because we full up already, what's now the most advice we will give to people where they listen you perhaps and get somebody who don't come in contact with the drugs and the family, how for manage the condition at us, for let the person on left go na street?
It's difficult also for make you manage possible get addiction issues now because they can become violent, aggressive. Yeah, it's difficult. And back for manage them sometimes as an outpatient again. It's difficult because without that urge they come, that craving. I like you said, they can boss yourself for make the escape. Now hospital.
Escape formula.
About 99 door abscond.
Wow.
Last weekend. Last weekend, it was like a riot in the hospital. Now one word. They destroyed the place. And we not get enough security. They destroyed the place. And most of the guys, I'm not going to say, most of them get an antisocial personality issues. Most of them. Yeah, so and now the drug they just can make the worst. So
how can you manage the wouldn't keep being at that mood? Wait till you give them for calm them down.
Medication and sometimes we restrain them through medication or soft restraint or put it on some side. But we see this. We see that they one place that the plan for do bad thing there. That imagine a hospital where we just make they don't damage the place. Every day we repair.
Now we think you want commoner do for go get the substance making it become violent?
Some, yes. Then some not just part of the not just part of the personality. Yeah, lawlessness. Gets a criminal way of behaving or thinking.
Because I ask, some man can say we take they make a quiet. Like the one that always consider in the sleep by themselves. So why don't they own different? On a way it is common at the system.
Yes, now the withdrawal and the yes. The withdrawal now that's the like they Alex if you look at it one damage this for make it just go get out. Some like even jump. And again, just the kind of talk. The community back not help you. That's so surrounding the of Kissy. Outside of the outside the hospital. You not gonna believe say now so get to the right around the hospital. So of course the hospital not to prison. We person don't stabilize. We can allow them for me they move around. This that. So they can turn up inside the compound at the hospital. The defense are you. That code we the one with the Uber. So the one with the Uber now they can send this substance inside the hospital. Then God, those guys there. Some they jump the fence, go get the drugs and come back inside.
Then counter inside to the company.
Yes.
In terms of withdrawal, Doc, what you go advise a family with perhaps somebody to go through this? Because you go see some family tell you say, I they cut them off everything where we don't they get, so you don't get access to money for them who buy the drugs. What you go advise if anybody they watch where they go through that?
Yeah, because most times now they get money they go buy. But again, we person are addicts. Alex self, you not get money. The fend all kind means. So they go thief for me. He go sell something. Even himself, in your personal things himself, he go sell them just for make. I know a patient where I'm in parents, they get everything. Na Dios. In one girl I need it. TV, chairs, everything we need. He sell all thing.
The withdrawal is automatic? Or how long did it take for like really able for comfortably come out from the addiction?
Mickey always tell us say that way how they feel, you not go kill them. But just for short time. But when everybody can it is heavy on them. We can make they can do anything. Because they say the life they can go. So they can just do it just like we person the around or you see danger. You can't do anything for make you escape. Now the same thing with them withdrawals there.
It's listening to you this morning, it gives somebody a different perspective of how this whole thing they work. Then again, it will make you realize, see, then people had a battle with a problem rather than you push them away. Like the many one there within the streets of Freetown, how they roam about with the source them, they don't get access to medication for healing wound. And I see a video of a parent na Waterloo where they cry for me say now in picking foot. In picking they call and say they can go for cuts the foot them. The one the way they na the treatment center right now, na that condition they then can wait.
Yes, they can out different condition there. You get something like kidney don't pack. You get something like heart, some like liver don't pack. And back. You get back most times. We possibly abuse drugs or they use drugs. A highly vulnerable. They go abuse them. Maybe they go get HIV, hepatitis, get syphilis, all the things that they so it's something we very disheartening for see.
Yeah, because I ask you this question, Doc. Communities they treat them people are now like criminals.
Like criminals.
Forgetting that the medical condition, then they battle with a lot. Now, the more you draw them, it possible they love help them. Because they see some parents and now then they push them picking them out.
Yeah, again back I think we will be down. They are or we have fundamental issues. Even the way we train we pick them out. Again, I think that's also now a major challenge because if you get picking at an early age, they don't get what to call conduct disorder or you get what to call oppositional defiance disorder. And they not they listen to you, they do what you want to do. When nobody talk, you curse. In those days, people they tell you say, first na community they train picking. But now, if neighbor self lay you picking complain to you, you dey vex.
Rehabilitation expensive, Doc?
Very expensive.
It's not the cost range.
Very expensive. Most times what can send patient out for rehab. They spend like 1,500 equivalent of the country where they go. Because most times I can send them Kenya. Yeah, expensive. Yeah, because a whole package. Now a whole package they get there. Treatments, detox, rehabilitation, recreational activities. So expensive feed them. Wait till the person want eat. 90 they give the person. Expensive.
So, Doc, with all of these things that we don't discuss this morning, it's been quite a lot, 1 hour, 30 minutes, eh? Even me, I learn a lot. And I sure say lots of people who don't listen to you, then perspective or behavior towards them people there go change. And generally, support-wise, when they get the necessary support?
Yeah, in terms of support, that na a concern. Yeah, mental health what was neglected. So and
neglect or na the awareness will not be get as a country.
The awareness be there because Dr. Naim baby they talker. They let Dr. Naim may always in peace. Be they talker. Say Sierra Leone get mental health issues. But when the people they talker, they laugh. Say how the party behave like the patient there. But it was the fact. Maybe they say. I think say we miss an opportunity, great opportunity, during with the disarm and I call it rehabilitate or waiting the after the war.
Yeah.
We missed that opportunity there. But
so not heal from the war mentally.
Of course, because can say most of the one now we they now maybe not the one where they're born either during the war or so say immediately after the war. You see, so
Gen Z them.
so is the issue. The challenge there, but now I think say now government don't show a commitment for me to improve mental health now the country. But again, we just try for talk even to partners there more for me to support we.
All right. Thank you, Dr. Abdul Jalloh, who joined with this morning. Yourself can help for raise awareness and also share your expertise. And if you don't listen to Dr. Jalloh, it clearly should say anybody with a battle with drug addiction, it need care and support rather than the community and they push them back. Yeah, you waiting Dr. Jalloh they encounter at the hospital. They don't spoil all the hospital. Sometimes it can be very tough and they not get that kind of security for put everybody under control. Now a hospital of 250 beds where they get presently. So now people that we need love, now people that we need support. If you get anyone at your community, find way how you go cancel them, find way how you go show all the necessary love. As it is now as a country, we not get the capacity for take everybody into the treatment center or maybe rehabilitation centers, but we self get a responsibility as people for that we help some of them people that we can don't become addicted. Thank you, Dr. Jalloh. It's been a pleasure talking to you as always. From time to time, when need be, we will bring you now so for let you to talk to people, especially when it comes to mental health. I think then they affect a lot of people. We not even aware say I'm struggling with my mental health. Some man go just be saying anger issues you get. Some man go just be saying, oh now add up the money. They don't see the person they struggle mentally. So from time to time we will bring you for speak on the issues there. So thank you for joining me this morning.
Yeah, thank you so much.
All right. Well, now they end this edition of the Breakfast Show. It's been a week. We don't deal with drugs. We don't deal with Kush in different perspective. We don't bring different people or don't bring government authority them. We will continue to talk about this issue until the awareness day and until the law enforcement agency then begin to do the right thing for ensure say then cuts the supply chain. As we all know, lab then they now in the country and you hear from doc, no sign, no safe. even the workplace, people and they where they into substance abuse. So now for the check your colleague, check your family member, you picking at us, the schools them, they'll be vigilant as parents them. Make sure say you watch you picking. Yeah, waiting doc say if you experience a strange behavior, how the person be they behave, you experience a certain thing, don't change param. Now for monitor, let we all be monitor them na the community, watch Uda and Uda they sell them, go to the law enforcement authority, them report some of them cases there so that we all go work together as a country for fight this particular menace, as how Mauritius collaborate and fight them today they are safe. So now they end the breakfast show for today. Many thanks for you who don't join we, and continue for listening to Liberty TV throughout the day. Continue for watch with different content they will produce of public interest. Mina Khadija Bango, they say have a lovely weekend.
All right, and till we meet again, Mabel Kabade, say get a good weekend, and like always, if you see something regarding the Kush, now for say something. Bye.
Mina Yvonne Akisoya, Mayor of Freetown, and I want Rob Mott Lilibit for this proposed plan for divide Freetown into 3 cities. The reason why government give, they're saying that because of development, they're saying that because of improving service delivery. I can tell you up front, any city where they, who side we not plan the use of land, you not get land use planning, who side building permits, they're not effective, it go mean to say access will be a problem. And also access not a problem, you will get challenged with disaster, you will get challenged with emergency access, you will get challenged with sanitation. And let me watch for we self, the reality of waiting 45% of we city actually fever.
Me 3 grand picking there with me picking in wealth in mama. They're all not dying at this water crisis because people block the place where the water can be just can't flush the hose. Then 4 die.
People just they build all side. So even this community what this place them when an access road where vehicle for come. As soon as you the kind side, so you na be access road. If incidents happen now, vehicle one kind side, ambulance one kind side. Now this community for can collect, let's just say emergency. I wanna feel say that the ambulance go cancel. They want to pass them to and can go na the main line.
You see, start Mapia, motor no de kaya, bike no de kaya, or say bike de kaya. We try to cool and safe. This clean salon business. For kind size in able enter. Pass we take the dirty them, go to our side. So don't build at the place.
You see? Then the Tidana way the community people, then they pull from and where they see small rain, where then the twin and then drainage. Now then they wash now the streets where we can see. You know, I feel like one time where rain come by Kisiod, where at the pass, rain come, I see a huge dirty in the middle of the street. You know, where because of people don't get that ideology and that mindset, they say where rain come, then garbage, they only forgot to run a gutter, let water wash them. And forget say now the city then the dirty. You know, I feel I'm for the council people on that day because them be don't work that morning day, then where rain come, then come back, then can't sweep.
All this are because of planning all day. All man they do so better. Guys, you can go inside for get the dirty them. For care and go na do. Some people not get choice, so you go give them clean, so you clean, so you go left for people and do what's there.
Because they don't say Freetown City Council, holy solely, they're facing a council they do road, they're facing a council they give building permit, let people and build a road, let people and block us and access road where people want to car for pass or guys for kind side, for collect people and not to mayor they in charge of giving building permits, not to mayor they in charge of making road. We get the SLRSA, we get the Ministry of Lands, when are they in charge of issue those things to people where you know they do them thing and they. If law and order no they all man they go do no more what he wants, who side salon they go.
Freetown City Council not give up. We still move forward with new sanitation bylaw, and we really expect for see continued improvements because we don't make improvements. Dividing the city, the situation go worse because the Lily money we for go towards service delivery will now go for run the operating cost of 2 additional councils. So let we not fix the wrong problem. The problem we need for fix na the problem of service delivery. Dividing Freetown, no get for fixed now and
Country like Salon also every decision they touch the life of plenty people. One program they bring the voice of the people to the heart of politics.
This na Politics and the People, the program where they give the power to the people, explain the truth, and bring the leader them close to the citizen them.
Real discussion, real voice them, real impact. Join the debate and make them hear your voice.
Every Tuesday, 8 p.m. na you platform where they turn up for the truth and civil engagement. Only on Liberty Online TV.
Let me talk about politics. Let me talk about people.
Term them like this, where politics they shape the future, career they define we path them, and the economy they touch everybody in life.
Big thank you to
One program where they ask the hard question them and seamlessly bring the answer them close to you, face to face with the movers and shakers, the voice them will matter, the issue them will count. One time per week, one big name, one big issue, one-on-one on Liberty Online TV. Every Friday, 8 to 9 p.m. with Khadija Bangura. One-on-one, only on Liberty Online TV.
You are watching Liberty Breakfast Show on Liberty Online TV.